Well, hello there. How are you guys? So today is Wednesday, June something, 2026. This feels like a diary sometimes. So today I was thinking about the topic of our little chat, and I have few topics in mind, but some of them heavy. And I didn't want to have a heavy topic today. I wanted to have something that is pretty happy, I think. May bring some inspiration of hope to some of you. So today we're going to talk about my journey with Syngap Research Fund, or now Cure Syngap1. Because when we started our beautiful relationship with Syngap, it was still Syngap Research Fund, and it was pretty new foundation. So let's talk if you're interested. So my Akasha was diagnosed in 2020. It was October 2020. If you remember, it was right in the middle of the pandemic, COVID-19 pandemic. We were right in a, everything closed, and I don't have to tell you, you know how it was. I mean, you're old enough to remember. Even if you're a young parent, you're still old enough to remember the pandemic. So it was rough. If your kids are very young, then you're so lucky that they were born after the pandemic, because it was rough. It was rough on us to parent children in general, but to parent children with special needs, it was just rough. Let me just tell you that. So anyway, it was in the middle of the pandemic, and she did get diagnosed finally. If you want to know her diagnostic journey a little bit more, I can talk about that as well. But I feel like diagnostic journeys are pretty similar, and if you did get diagnosed with Syngap1, you probably had similar story. Like at some point somebody did genetic testing, right? Our stories are a bit different. Each of our stories are a bit different, but if you're a parent and listening to this, at the end we got diagnosed with Syngap1. If you're a researcher, or if you're a doctor, or somebody interested how this kind of condition is diagnosed, there's Syngap warriors stories on turning, you guys, changing lanes. It's important. So and you can read those, and you can listen to some of the other podcasts too, and maybe one day I'll record it again. And also Syngap stories, part of our diagnostic journeys in Syngap stories. So I recommend it, with Joe Ashline. Very well, that was really emotional to me, and because talking about that time, it's very emotional. But anyway, let's talk about Cure Syngap1, formerly known as Syngap Research Fund. So I at that time, this was a very small foundation, because remember, in 2022, I think SRF maybe was 2 years old, and again in the midst of the pandemic and everything else. So back then there was just a handful of people that were really involved in day-to-day operation and like a patient engagement, and it was all done virtually, of course. So the same day we got diagnosed, we got plugged in with community, and we started talking. And I talked to Jess, and I talked to Mike, and I talked to other people, Monica Harding, Aaron Harding. This is something probably people take differently, when you're first diagnosed, because if if you have a small child who doesn't have epilepsy yet, and small children are not very different than their neurotypical peers, so you have this shock of diagnosis, and even back then we already knew that the trajectory of this disease is not good. So we already knew that Kasia will require 24/7 care for the rest of her life. She will never be independent. She probably will not talk, even though back then we thought that she might, because she was just 3 years old. And it's a devastating news. And when your world's spiraling around, like, you find comfort in control, right? And if your world feels out of control because your child just received this diagnosis, that is just devastating. And you still had this hope that she may catch up, because it's different when you get diagnosed when the child's older, let's say 12, 15, 20 years old. Then I feel like you already have all the symptoms, and you already see that the depth of this disease, and the diagnosis may come with the relief, and with it may be welcomed, right? Because you already went through it, and you looked for answers and searched for the answers for so long, and now you have an answer. So it may be a different situation for little older children than for tiny little children. So anyway, but for me it felt like I was just spiraling out of control. There was no, it felt so heavy, and the grief journey was so heavy. It's really hard to even describe in words, but I'm turning again. But we got plugged in I did the first day we got diagnosed. So, and the first week, and it was so funny because I still remember Mike, like talking to me. I swear, the first day, and he was telling me, you need to talk to Monica. You need to talk to Monica. She's in California. You're in her region. Back then we had like regional ambassadors. So she's in your region. She will be able to help, and she did. And but Mike, like right away, pretty much right off the bat, said that we have this natural history study, this program called Citizen, and you need to sign up. And I was telling him, like, I don't have a genetic report yet. Not that I knew what genetic report was, but I just received a phone call from the geneticist saying this was Syngap1. I didn't have any paperwork yet. So, but I did. I got paperwork, within a week. I think next day. I mean, short, because I did talk to the genetic counselor and geneticist the same day on the phone. They did send me the report, and we had the consultation really, really fast. So it didn't take much time. But he was on me like, you need to sign up for Citizen today. And when you get diagnosed with a genetic disease, like, most of the things you were told you don't even remember, because it's so emotional. But the one thing I remember, because you have to sign so many pages of paperwork, and they tell you, your genetic information is private. You don't share this information with anybody. We will not send it's like super protected, right? So then when somebody tells you, when you just met and you have no idea who they are, no clue, give me your genetic report, give me all your genetic data, sign up for Citizen, we will help you. It's just such a shock. It's just like, oh my God, like, what, do I just give it to you? It sounds silly to me now because I know better now, because of course there's nothing to hide, and there's no reason to hide it. I mean, you can't hide Syngap anyway, so what's the difference? Plus, the reason they asked me for my genetic report is because they wanted to know if I truly have Syngap. Since then, I mean, not Kasia. Since then, I've met so many people that, wanted to get into our Facebook groups, in Poland, especially, because that's what I do. Well, I did back then, on a daily basis, that they say, well, I have Syngap, or somebody has Syngap. It turns out that they don't. They just don't. They got confused. There's something different on the genetic report, or they have a variant of VUS, so they have a variant that it's not confirmed. It's very important that you actually know your diagnosis, right? So why is it important? Because if you think that you have Syngap and you actually don't, or it's not confirmed, it's very confusing to other people in a group, because you may be talking about your experience, and your experience may have nothing to do with Syngap, because you may have different disease. But more importantly, if your child has symptoms, so if it's not Syngap, then it's something else, and you're not helping yourself or anybody else being in a Syngap group, because you need to know the true diagnosis, right? So there's a lot of reasons that you may be asked to show the genetic code, genetic report, and it's all in your best interest, seriously. I mean, but at that time I thought, like, why do they want this documentation from me? Because I just didn't know any better. I just didn't know anything. So, but I decided, you guys, and I recommend this to everybody. When you're world spiraling and you just don't know when to anchor yourself, Pure Syngap1 is a good place to anchor. It's a good place to anchor and trust, because you can't, at this state, you can't verify really if somebody's legitimate. I mean, you can Google, and there's a website, and now there's so many more. Pure Syngap1 has so many more resources. It's really easy to just kind of know what you are. But back then, I had to just trust. I mean, there was a website, there was a group. I believe this is real. I mean, there was no doubt that SRF was real, but I didn't really know the people, and I could never. I mean, I didn't have any way to verify if those are good people, honest people, or they're working in my best interest or not. I had to trust, and I did. I trusted, and I decided you have to trust somebody. You can't get through life, and especially this situation with a genetic disease that is devastating. You can't get through life without trusting somebody. And I gave, them my full trust, and I just gave them what they wanted me to give them, and I was so much better for it. Now I'm thinking from the perspective of time, is just, oh my gosh, it's just, I benefited so much from this community of people that I trusted. They never, I can honestly say, they never really tested my trust. They never did anything unethical or anything that I would feel like I'm not safe. I am safe with Pure Syngap1. I am safe. So this is the first thing for me about Pure Syngap1, was this feeling of safety. And when you're grieving so much, even this piece in your heart that can feel just a little bit safe, that somebody's watching after you and your interests, and you can trust what they say and take their advice, and use it the way you wish. So I know I'm rambling about this, but it's really hard to express in words how that feels. But I don't regret that. I don't regret trusting Mike and everybody else in SRF. I am so grateful for all the support I received as a newly diagnosed patient and a family. And yeah, it was pretty much blind trust. And I've grown so much since then. I've grown so much since then, but I'm grateful for that. I'm grateful for them. So, and since then, it's what Mike says, that you kill grief by action. It's very true for me. It may not be true for everybody, but it's very true for me. So there was a lot of growth in me, because when I first started looking at Syngap, I remember talking to, via messages, because I was not even able to pick up a phone and talk to anybody on the phone, because I just started crying, and I just couldn't talk about this. I couldn't, I didn't understand what they were saying to me when they talked about Syngap. So I prefer to just message people, but I still didn't understand. I mean, Aaron was talking to me about this, variant or whatever, and I still didn't understand. So, and I remember starting watching the science videos SRF started putting out. I went back a little bit in time, and I watched those science videos, and I remember crying and telling my husband. If you don't know, my husband is a physician. He's a pathologist at the University of Arizona, Banner Hospital, and he's also a scientist himself. I mean, he's involved in some research, and he's very familiar with genetics. Well, not like modern genetics. He does have an undergraduate degree in genetics, and he's a doctor. So I remember talking to him, like, I don't understand the words. Like, it's not a language barrier for me. It's not something like, well, I don't understand this in English. I don't understand this in English, and I don't understand this in Polish. I don't know what they're talking about. This is like totally new vocabulary, and I don't know. 80% of the time when I listen to this science video, 80% of the time, it's like they were talking like Klingon. I just didn't know like what. And I remember him telling me, just listen, just continue to learn, one day you will understand. I can't say I understand it now, I really can't, but from maybe 20% of understanding what the words itself, it's crazy. I'm pretty much now maybe 50%, and when they have a science video, maybe I understand like 50% of this hard science, even though they try so hard. But at some point I realized that it's not my job to understand hard science. I'm a parent. I need to understand what's practical for me to understand, and the findings of that science, right? So I think I'm at that point that, and I've watched all the videos. You guys, I mean, I was never a great student, although I have an advanced degree in finance, but I was never like this one of the top in class or anything like that. But when it comes to Syngap, I feel like I'm a just perfect student, because I will watch everything twice, 3 times if I don't understand, then go back and watch it again, and because I really needed to understand what's going on. Like, I needed to, in time, to understand what's going on, and Syngap1, they just helped me with that, right? They talked to me. They answered all the questions. At some point, Mike said, well, you're asking a lot of questions, and I think we need to bring you in to our organization. And I said, okay. And at some point, I think I said that, use me, in any way you think I can be useful in the organization. That was probably at some point something I would say. That time is a little blur, so I don't know for sure, but that feels right to me. And Mike said, yes, everybody's welcome, come on. So I did, and for the longest time I didn't know what my role would be. Actually, at the beginning I thought, what organization needs is money, so I need to focus on grants. I thought that we need to write grants, we need to get money for SRF, and that really never was my role in Cure Syngap1. I kind of pivoted naturally to my work in Poland and finding patients and families in Poland and starting organizing those patients in Poland. And that story is on the Syngap Stories with Joe. So I recommend, again, go back there. I'm not going to maybe one day I'll talk a little bit more about this, but I'm very proud of our Polish community. I'm very proud of the organization that is now very strong, and I have a different role now because I don't do what I did before when I was just starting to look for those patients in Poland. So now I have this a little bit extra, emotional capacity and some time to actually talk to you guys and do some videos and more work in US, because the Polish organization is standing strong, and I can be just a bridge between US and the world and Poland and help in any way I can. But I don't really deal with day-to-day operations anymore in Poland. They do it themselves, you guys. Very proud of them. So then I started then my role became also Arizona ambassador. By the way, Arizona, if you want to be ambassador of Arizona or co-ambassador to me, please do, because I think we need to do a better job in Arizona in general. I think we can do a lot in Arizona, and I'm just now emerging as having a little bit more capacity to do more things in Arizona, but I need community, I need help, right? So I think we can do a lot, especially now when the clinical trials are coming. I really think Arizona can be important. So my fellow Arizonians, I invite you to talk to me. We do have an email exchange with our group, but I think we can do better. So I think I'm going to finish on that. It was a lot of rambling, but my message to everybody is, if you're newly diagnosed, just find somebody you can trust and anchor yourself in Cure Syngap1 organization. Now we have so many more people involved, but it did help me a lot to do that. And we have so much hope now. Back then we didn't have any clinical trials coming, we didn't have any companies interested, so it was a lot different situation. And now I feel like there's a lot more hope and real chance for treatment. But even if you were diagnosed 5 years ago, but you don't feel like you find your place and you don't have this kind of anchor, reach out to me. I mean, I don't care where you live, just or find somebody you connect with, you can be friends with, and you can talk to them about your life, not necessarily only about Syngap, but your life and your thoughts. it helps you guys. It's a safe place. That's what I'm going to say. It's a safe place. Don't be scared. Nobody's going to reject you, nobody's going to ignore you, and nobody's going to take advantage of you. It's safe, and it was safe for me when my life was just completely falling apart. It was safe, and that feeling of safety is worth everything, especially at the beginning. Later on, you learn how to live with this disease. Your life is getting more organized. It's a little bit better to think a little bit more clearly. But again, I've never regretted to be part of Cure Syngap1, formerly known as SRF. I think it was my lifeline. I think it saved me. And I can't say I don't have a big job in Cure Syngap1. Like I'm not a board member. I'm not a director. I'm not officially, I mean, I'm an ambassador, but I'm not officially, I don't officially have a job, but I try to be useful. So I'm happy to be useful. So if somebody can use me, then I'm happy to do that, and that it's as simple as that. And I have the space to do what I feel like needs to be done. You know, part of it is this podcast that should be on a Cure Syngap1 platform, but you know, Beata is not great with like doing things the correct way. So anyway, hi Ed, if you're listening, I'll get that done one day. So, but if you, it doesn't have to be a big thing. One more thing I'm gonna tell you before I go. I know this is like the fifth one more time. The feeling of people working on your behalf is also so just golden. Because I remember lying in a hospital with my second daughter, Milena. I remember being bedbound for a month. My water broke at 32 weeks, so they kept me pregnant for another month in a hospital bed, but I couldn't move from the hospital bed. And I remember this feeling of, oh my God, I can't do anything. I am here just emotionally, physically, you know, devastated, and there's people out there in Cure Syngap1 fighting for my daughter. I still remember that. Even though I couldn't do anything, I was useless. So because I had to take care of myself, I had to take care of my baby. I had no really time, you know, other than just, you know, do, you know, like a post or share a post or do something on the phone. But you know, you also have to have emotional capacity to do anything. I remember sitting there and thinking, oh my God, while I'm here, they're out there working on my behalf, and it's worth everything. So, oh my gosh, now I'm crying again. Anyway, I need to go. Okay, bye guys.